How did Tuskegee lead to the Bioethics Belmont Report? Have you ever wondered how a troubling chapter in American history shaped the way we think about ethics in healthcare today? The Tuskegee Syphilis Study is a key part of that story. Conducted from 1932 to 1972, this study by the United States Public Health Service involved observing and treated syphilis in poor African American men in Alabama. These men were misled into believing they were receiving treatment for what was called bad blood. In reality, they were denied effective treatment, even after penicillin became widely available. This study is a stark example of ethical failure. The participants were not given informed consent, meaning they did not understand what they were part of. They were exploited and suffered significant harm because they were kept in the dark about their health and treatment options. When this study was exposed in 1972, it revealed serious ethical violations. The public was outraged, and it became clear that existing protections for human subjects in research were inadequate. In response to this scandal, the United States government enacted the National Research Act in 1974. This act led to the creation of the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. The commission was tasked with developing ethical guidelines for research involving human participants. By 1979, this commission produced the Belmont Report, which outlined 3 fundamental ethical principles that continue to shape healthcare and research ethics today. The first principle is respect for persons. This principle emphasizes the need for informed consent and recognizes the autonomy of individuals. The second principle is beneficence, which requires researchers to maximize benefits and minimize harm to participants. The third principle is justice, which demands fair selection and treatment of research subjects, ensuring that vulnerable groups are not exploited. The Tuskegee study directly influenced the creation of these principles. It highlighted the dire consequences of ignoring ethical standards in research. The Belmont Report serves as a foundational ethical framework that guides institutional review boards and researchers today. It has led to practices such as mandatory informed consent, risk-benefit assessments, and fair participant selection. These practices are now standard in healthcare research to prevent abuses like those witnessed in the Tuskegee study. Understanding this history helps us appreciate the importance of ethics in research and healthcare. The lessons learned from the Tuskegee Syphilis Study continue to inform how we protect human subjects today.